أعوذ بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم وصلى الله على النبي الكريم. I wish to warmly welcome you all to the second edition of our monthly press briefing, which is designed to keep the general public informed about the achievement of Kaduna State Government under the leadership of His Excellency Malam Dikko Radda, PhD, CON. Yes, you may recall our focus in the maiden edition of our monthly briefing was on administration and social sector. Our briefing today will focus on achievements recorded under the health sector, which is a critical component of our administration, as outlined in building our future document. This administration has from inception to date accorded priority to quality healthcare services to our people. In an effort to address issues of human capital development in this sector, government has recruited additional 254 health personnel for secondary health facilities in the state. This is with a view to injecting more manpower to handle growing health demands. This includes medical doctors, nurses and midwives, medical lab scientists and pharmacists. Also, arrangements are ongoing for the third batch of the recruitment exercise. Furthermore, in an effort to address the shortage of medical doctors in our hospitals, government has provided full scholarship for the training of 41 students to study MBBS in Egypt at the total sum of 2,449,899,800 naira. These consist of payment of tuition fee, accommodation, transportation, books and upkeep allowances, among others, for the entire duration of their program while they are in Egypt. In addition, the entry point of salary for medical doctors has been reviewed upward, and their residency training allowances have also been enhanced as a moral booster to improve efficient healthcare delivery services. In order to improve the capacity of indigenous doctors and others to become specialists, this administration has also commenced residency training in obstetrics and gynecology, pediatrics and family medicine at Turai Umar Yar'Adua Hospital and General Hospital Katsina, respectively. To this end, government has also approved the payment of accreditation of medical residency training and license fees for medical graduates. Additionally, arrangement is underway to commence the third batch of residency training at General Amadi Rimi Specialist Hospital, Katsina. The state government has also sponsored some resident doctors for residency training in other health tertiary institutions within the country and expanded the sum of 26,900,000 for their training. Attention has also been given to the provision and upgrade of infrastructural facilities in the sector. A number of health facilities across the state received significant improvement in the area of construction, upgrade, and equipment. In this regard, government has expanded the sum of 13,453,852,735 naira 6 kobo for the upgrade of 146 primary health facilities to a functional status across the state, with a minimum of 4 centers in each of the 34 local government areas of the state. In addition to this, government has approved the renovation and upgrading of comprehensive health centers, Erimi, Paskari, Dandime, and Zango to general hospital status at the cost of 3,702,100 50,724 naira. The state government has also completed the renovation and upgrade of General Hospital Kafur, as well as structures at General Hospital Kankia at the total cost of 739,523,884 naira 50 kobo. Furthermore, government has upgraded and converted COVID-19 isolation center to psychiatric hospital at the total cost of 65,845,895 naira. Similarly, the former psychiatric hospital building was upgraded and converted to a permanent site of College of Nursing and Midwifery at the total cost of 104,478,395 naira. Gentlemen of the press, government is also making frantic effort to curtail medical tourism and hence the commitments to establishing state-of-the-art facilities for the benefit of our people. Consequently, this administration has completed the construction and equipping of dialysis center at General Ahmadi Rimi Specialist Hospital, Katsina, which is adjudged to be one of the best in the country at the total cost of 681,104,727 naira 92 kobo. Additionally, contract for the construction and equipping of a modern imaging and diagnostic center was awarded at the total cost of 13,137,170,677 naira 93 kobo, and work is currently ongoing at the site located at General Ahmadi Rimi Hospital, Katsina. Government has also realized the need to address the issue of sales and consumption of suspended drugs. Accordingly, Drugs and Medical Supply Agency has been strengthened to ensure purchase and supply of quality drugs through revolving scheme. So far, drugs worth 3,331,031,121 naira were purchased from reputable pharmaceutical companies and distributed across health facilities across the state. In addition, the state government, in collaboration with Global Fund, renovated and converted a warehouse to a pharma grade at the total cost of 766,815,832 naira. This facility is strategically placed to play a vital role in ensuring efficient storage and distribution of essential medicines. Furthermore, the state government has awarded the contract for the construction and equipping of a modern pharmaceutical production unit at the total cost of 1,689,198,074 naira, and the construction is also ongoing. The state government has also sustained the free Medicare policy for delivery, antenatal, dialysis, cesarean section, and some other services. In this regard, the sum of 397 million was expended during the period under review. This exercise is meant to assist the teeming population of Katsina State, especially the less privileged, to have access to basic health care services with relative ease. Similarly, e-health solution was deployed to 7 health facilities across the state for enhanced efficiency in healthcare service delivery at the total cost of 244,440,000. Accordingly, in order to improve nutritional capacity of the vulnerable citizens, the sum of 504 million was paid by the state government as matching fund for nutrition commodities. Distinguished gentlemen of the press, government has also undertaken a series of awareness and prevention campaign programs, as well as the provision of medical support against HPV and cervical cancer, sickle cell anemia, seasonal malaria, in order to strengthen preventive measures against such diseases. In order to improve the efficiency of the state contributory health care management agency towards reducing out-of-pocket expenses of workers on access to healthcare services, government has strengthened the operation of the agency. So far, Katima has successfully enrolled about 96% of the formal sector enrollees into the scheme, totaling 272,910 beneficiaries and 127,003 enrolled under the informal sector programs. This brings the total enrollees under the scheme to 399,913. In addition, enrollment of approximately 26,000 retirees in the state under the Basic Healthcare Provision Fund is also ongoing. I'm pleased to inform you that this scheme has turned out to be a huge success in the state, as the agency has received awards for outstanding contribution to health sector for 2 consecutive terms from the Nigerian Healthcare Excellence Award, NHEA. The need for effective primary healthcare delivery services cannot be overemphasized. Accordingly, the sum of 1,912,640,301 naira was expanded by the State Primary Healthcare Agency to carry out its function for effective healthcare delivery service to the people of Katsina State. These activities include, among others, construction of a dry store, purchase and distributed laptop computers to local government authority monitoring and evaluation officers for data management to enhance evidence-based decision-making in healthcare delivery. Government has also procured and distributed commodities for containment of diphtheria outbreak as part of non-polio supplemental immunization activities. Similarly, a total of 2,216,573 eligible children were vaccinated during the period under review. In order to ensure adequate coverage of the nooks and crannies of the state, a total of 360 motorcycles were procured and distributed toward focal persons for routine immunization and related activities. So far, a total of 438 personnel were engaged for the success of this exercise. The state government has also undertaken the fight against the scourge of HIV/AIDS very seriously. In this regard, the sum of 69,919,000 was expanded for the purchase of laboratory testing consumables, prevention of mother-to-child transmission, and other outreach awareness campaigns across the state. His Excellency, the Governor, Malam Dikko Radda, PhD, has realized the need for synergy and effective collaboration between government and development partners to address health sector challenges in the state. Accordingly, the Governor has initiated, pursued, and obtained donations of hospital equipment from the World Medical Relief United States of America worth $10 million. In this regard, government has incurred an expenditure of 623,375,000 for shipping, administrative clearance, and logistic charges from seaport to Katsina State. Let me at this juncture assure the good people of Katsina State that government will continue to implement programs, policies, and projects that will impact positively on the citizenry of Katsina State. Government also continue to respond positively to the yearnings and aspirations of our populace. This will be vigorously pursued across all sectors in the coming year, 2025. Democracy is government of the people, by the people, and for the people. We shall therefore not relent in our unwavering commitment towards serving our people. The timely passage and signing of the 2025 budget is a testament of our collective commitment to honestly execute programs and projects for optimal service delivery to our people. I would like to conclude by thanking the good people of Katsina State for their support, understanding, and prayers for the success of this administration. His Excellency, the Governor, Malam Dikko Radda, PhD, CON, is determined to move Katsina State to a much higher level through implementation of people-oriented policies and programs. Thank you. God bless Katsina State and Nigeria as a whole.